Ascension is the nation's largest not-for-profit healthcare company. It has over 100,000 employees. It has over 30,000 providers.
So our traditional tumor board is a meeting that is on a set date and time, and it includes a group of specialists who come together to talk about the patient's care. And we had the opportunity to apply for a grant from ACCC, which is the Association of Community Cancer Centers, and this allowed us to trial an innovative approach to tumor board.
When Ascension was looking to create this new virtual tumor board, they wanted to reuse the Microsoft technologies they already had in place because those technologies are secure, they meet the HIPAA standards that the industry has, and so the core of the virtual tumor board is the Microsoft Teams technology, and we're using it in highly innovative ways. In addition to Teams, we use Power BI, we use OneNote, we use SharePoint, so we're using the whole Office 365 suite to provide a very collaborative experience to the users.
So I think one of the biggest advantages of having a virtual tumor board is the ability to weigh in on other people's cases, and similarly having other people review the cases that I directly handle.
So the virtual tumor board allowed us to discuss more cases from a multidisciplinary approach compared to our traditional tumor board. The providers can participate when it's convenient for them and a device of their choosing.
Today, tumor board has evolved from a retrospective process to more of a prospective process. We want to be able to present the information before the patient gets treated.
So the cases are archived, so you can actually go back and review what you said and what others said. So it is a continuous way of reviewing patients' cases and discuss what went right and what could be made better.
So what was really rewarding for me is that we were able to take a different approach to our tumor board, which really allowed us to talk about patients earlier, impacting the way that we provide care to them.
The most personally rewarding part of this has been both to see this project forward, but also to collaborate with a great team. I also think that this is ultimately going to be a real help to patients in terms of providing them optimal care in their treatments.
Working with Ascension on the virtual tumor board has been the most rewarding project I've ever worked on, and I think the rest of the team feels the same way, because we're really making a human impact and a difference in the lives of the patients. And we're able to run a lot more patient cases through the virtual tumor board than we could in the past.